the real thing is learning and motivation to learn, you know, wanting to learn, wanting to be a good social scientist, a good sociologist, a good human being, serving society, and first your family, first yourself, then your family, then your society, and then humanity, all humanity. That is what I try to teach my students, implicitly or explicitly. That is the message that I would like to give you. Okay, now if you don't have any other questions, I will start. Waiting for questions. Okay, no questions. So I will start. Now, today I am going to talk about sociology of health and illness in Turkey, or the relationship between social structure and health and illness experience of the population, of the people living in Turkey. So I will not be able to touch all relevant research, but research that I know of course, in detail. So I will report about the research that I know the details, as I used to do in the previous weeks. You know, instead of a quick survey of all the research, you know, which will be at the surface level, you know, I try to give information about fewer research, deeper, fewer and deeper, instead of more and shallow. Okay. So now for me, when we talk about health and illness, or children, about children and their health and their death or survival, you know, when we talk about these issues, the health of the population at all ages, when we talk about them in Turkey, I have to remember, or I have to remind a medical man, a professor of medicine, who became at one point in the history of Turkish modernization an administrator in the Ministry of Health, and he developed the project of opening health centers in almost all villages of Turkey. Well, not all villages, of course, in most of the villages, so that all villagers throughout Turkey, in the east and in the west, in the north and in the south, can take their children and themselves to the health center for the care of the doctors who are either interns in medical faculties, or who are recent graduates, or who are specialized doctors and nurses and other health personnel in these centers. Now, in few of them, together with my wife and children, as I will talk, I worked in few of these health centers. How they work, I know. But before I go into them, let me finish my information about Nusret Fişek. Nusret Fişek was born actually in the beginning of the century, yeah, more or less in 1914. Okay, now and he had a high school education in Kabataş High School and Istanbul University, and then he had his Doctor of Medicine from Harvard University, you know, one of the best medical schools in the world, and he specialized in bacteriology and biochemistry, food biomedicine and food chemistry, and but his real contribution is in the public health or community medicine. He was one of the founders of Department of Community Medicine in Hacettepe University, where your professor Belma Akşit worked. Okay, so from here I come to Belma Akşit because Belma Akşit is a sociologist. She's a sociologist as well as a medical person, because after having her sociology degree in Middle East Technical University in 1973, she was an MS student in Institute of Population Studies of Hacettepe University, where Nusret Fişek was at that time was one of the staff, one of the professors there. So she obtained her MA degree in 1978, and then she was in the Institute of Health Sciences. In the Institute of Health Sciences, she got her PhD in family medicine. But she worked as a field sociologist, doing field work in the arena, in the field of health and illness, actually. So as she finished her MA degree, she started working in a high-risk project, which was supported by World Health Organization, with which you are too familiar because of the pandemic during last 2-3 years. So this work was between 1978 and 82, and in the meantime, she worked in Çubuk and Etimeskut, in the family planning and health services centers, or health centers. You know, these are health centers, and I remember her coming sometimes at night, you know, around towards the midnight, really. You know, I remember her coming at 22 o'clock, you know, or 10 o'clock p.m. And reporting, you know, when she was coming from such and such village, which is, you know, 30 kilometers away from our home, you know, the villages around Ankara, and encountering, you know, with the car, of course, and a driver of the car, encountering a wolf, you know, in a winter season, you know, it is snowing, etc. And we are at home together with Elif, Ekin, and Gökçe Su, our two daughters waiting for our mother, you know, for my wife. Unfortunately, I was not very feministic at that time, and I was waiting for her to come and to help, you know, for food or cleaning, etc. Whereas a feminist husband would have done all the housework, which really I learned late. You know, I hope that I know you know, most of my students in this course are female women. I hope that your husbands are not like my early days in being a husband. I hope they will be like me in a later period. Now, in 1989, we did a research together with her, with Elif, Ekin, and with Gökçe in Hatlı Gecekondu, Hatlı squatting house, squatter housing district or mahalle of Antalya in 1989, and it was sponsored by UNICEF, United Nations Commission, which is interested with the health of children, as you know. Now, what did we do there? We tried to evaluate how the health center is giving services, or rather, they are giving services, but we were interested as sociologists, how are those services being received, being used by the woman and man in Hatlı Gecekondu, in Hatlı squatter housing district, mahalle, neighborhood. Now, you know, we were living in a, we rented a house, in a Gecekondu house, and we lived there more than 2 months. And my wife, Belma Akşit, and daughters, Elif, Ekin, and Gökçe were responsible to organize, no, my Belma, to organize women, Elif, Ekin, and Gökçe to make aware of their age, their peers in the neighborhood, and I was responsible in organizing male members of the neighborhood about being concerned with their children's health, their inoculation, vaccination, their nutrition, following up their illnesses, etc., etc. Now, I should say that, you know, after 1 year, we went back to the neighborhood and we examined, and we found out that women were very successfully organized, and they were really, even they had their information cards, you know, about themselves, and they were really going, even talking with the governor of the province. Unfortunately, I was not as successful in organizing male members of the community, men. You know, men were saying, you know, the health of children is women's business. It is not our business. No, it is not. You know, it is a father's business as well. You know, being a father and being a mother, a responsible father and responsible mother, mothers were more eager and culturally also were ready. So Belma Akşit was able to organize them. But Bahattin Akşit was less successful because men were not feeling themselves responsible for the health of their wives and their children. So this was one of the findings of that project. Now, she continued, as I said, with other, for example, with abortion and other research issues in Hacettepe. But one that I will mention now is a drug abuse project, which is carried out by Belma Akşit in Istanbul. Now, it was a rapid assessment study, and it was sponsored by United Nations Drug Control Program in 1996 and 1997. Now, briefly, let me talk about this, and then I will go to a research that, an article that we did together. Now, here I show this. Now, this is a Turkish report. İstanbul'da madde istismarı, drug abuse in Istanbul, a rapid assessment study. And people from AMATEM joined mostly. AMATEM is in the health administration of Istanbul province, has this center which is concerned with alcohol and drug therapy center. You know, this is alcohol and drug abuse therapy center. So she did this rapid assessment together with the personnel there, and they together developed a methodology, a sociological methodology of assessing rapidly the causes, the consequences of drug abuse. You know, these are the personnel that involved from AMATEM, which is the you know, together Hacettepe Foundation of Health, in Hacettepe Foundation of Health and AMATEM. This research was done, and Belma was the coordinator and the administrator of the research. So who else participated in this research and who are, in a sense, trained during the research? Those who participated into 4 phases. You know, the phases are: first, review of literature; second, developing a methodology; third, applying qualitative methodology; fourth stage is quantitative methodology. So those who participated into all 4 stages are under the coordination of Belma Akşit: Yıldız Akvardar, Sema Aytaçlar, Duran Çakmak, Selen Onaran, and Ahmet Türkcan. 3 stages, participating into 3 stages: Julide Aral, and participating into 2 stages: Beyhan Coşkun, Adile Çavaş, Gülsüm Ertekin, Esra İlem, Ayşe Koyuncu. And only 1 stage: Cüneyt Evren, Aziz Karalı, Zerrin Kılıçarslan, Ümit Yazman. And the overall project coordinator at UNDCP, United Nations Drug Control Program, was Orhan Saygıdeğer. So what did they find, or what kind of research methodology they developed? Really, as I was telling you, when he was working in the villages, in the health centers of the villages around Ankara. Now this time, for example, she was working in Hacı Hüsrev. I don't know whether you know Hacı Hüsrev. Hacı Hüsrev is a place close to Taksim center of Istanbul, where unfortunately is an area where drug abuse drug abuse and drug agents, drug sellers, are there, and she, together with the doctors there and psychologists and doctors and whoever involved, they have to interview. They have to interview drug abusers and drug sellers as well, in order to have a real sociological picture. And they did that. And sometimes it was really risky. We were living still in Ankara at that time, and Belma was coming every weekend to Istanbul and doing this research for so many months. Really, that was really a successful research, and I hope that it contributed to developing policies about drug abuse and how to prevent it, prevention of drug abuse of all kinds of drugs, from opium to cocaine and all others. That was really a real contribution from the point of view of Belma Akşit. Now, before I finish this and go to next researcher, I would like to just show you an article that we published together. Belma Akşit was the first author in Medicine and Society journal, which is an international journal. As I usually do, let me share it. Let me show it to you. And I think one or two of you, one of you is have written a paper on this article. But this way, others will see it too. Okay, so let me share my. Here it is, my screen, and here it is. Now, which one is it? It is most likely this one. Yes, it is this one. Let me open it. I hope you see it. Okay, as you see, infant and child mortality in Turkey. Infant and child mortality in Turkey. Let me make it larger, a little bit larger. And how do I do it? From here. Yes. Okay, now this article has received many citations, because in this article we review the research on this infant child mortality. What are the most important factors in reducing infant and child mortality? Now, doctors usually use a medical approach, biological medical approach. But we said that biomedical approach in itself is not enough. It has to be complemented with socio-cultural approach. So considering socio-cultural factors, combining biomedical and socio-cultural factors. And as a result of the studies, we found out that, for example, mother's education is very important in reducing infant-child mortality. That is, every 1 year increase in mother's education, when it increases 1 year, the infant mortality rate or child mortality rate decreases. When you has a regression equation, it reduces so many points, you know. Similarly, being rural, urban, being you know, educated mother and grandmother, etc., etc. Grandmother being more democratic towards the mother, etc. You know, so many factors. Actually, Belma Akşit has an article on this health-seeking behavior of children, you know, where she gives more detail, and similar research are carried out throughout the world, actually, and they give references to this article. Let me send this away. And again, before I go further, let me just very quickly tell you about other publications of Belma Akşit. For example, with Münevver Bertan and Sevinç Oral, you know, who are you know, experienced doctors in public health department, where Belma was working as a sociologist together with Münevver Bertan and Sevinç Oral. They published this article, "The Risk Strategy in Maternal and Child Health Care in Turkey." You know, this is published in Acta Reproductiva Turcica in, again, 1989, the same year that our own socio-cultural determinants of infant-child maternity, mortality is published in Social Science and Medicine journal. The role of education of mothers is another publication in 1991. You know, there are all these others. I put them here. You can go into them and you can see them in detail, and some of them you can go and you can read and use in your own research. In later years, Belma Akşit went into total quality management in higher education in Başkent University and in Hacettepe University. She contributed to development of health, the development of quality assurance in these universities, and she has publications. Okay, now the second one, that you know, our family is involved in the health of Turkey, really, and in producing knowledge on health issues. So the second person is Elif Akşit, who is a professor now in Ankara University in the social sciences, and women's history is her area. She actually had her first degree in bachelor's degree in Middle East Technical University Public Administration, and then she had her MA degree in again Middle East Technical University Women's Studies, where she did a research on patterns of spiritual involvement of women in Ankara. And then in Binghamton University, she had her PhD, and in Hacettepe, İsembeke Togan was her advisor. In PhD, Donald Quatert was her advisor. Remember, when we were talking about Kemal Karpat's research, we also had studied Donald Quatert's review of Kemal Karpat's work on Ottoman Empire. So Donald was Elif Ekin's advisor. So Elif Ekin did more historical research. For example, she has an article on birth control or population control approaches in late Ottoman society. That is published in Toplum ve Bilim, Society and Science Journal, or again in Ottoman times and in Republican Turkey, population policies, and then she has women's knowledge, tradition, generation, and reproduction, a paper presented in Reproductive Health Working Group meetings. You know, she participated in many of them. And then she has an article on heterotopias on COVID-19. Now let me send this away. Oh, it was, I didn't share it, huh? It didn't come here. Okay, fine. You will see it. You can go in and you can see it. But now let me share the one about COVID-19, which is actually a research in the process of publication. So here it is. Let me just very quickly. So the chapter will be COVID-19 crisis, disaster, and new communities. Now, this is together with Özlem Şendeniz and Elif Ekin Akşit Vural. They will be publishing this. Now, I will just show this graph and then finish it. I will not go into details. It is not published yet. Can humans be considered as disaster? You know, with pandemic, COVID-19 pandemic, human beings is the center of disaster. You know, they cause the illness. You know, if they don't care about their masks, or if they don't report as early as possible to the doctors, if they don't have vaccination, you know, because mask, as you know, mask protects yourself 30%, 70% it protects the other. So if you are putting mask, you are also protecting the other. So you are responsible for your brother and sister. You know, you are publicly responsible. Now, if you don't put mask, you know, during those times, you don't care. You know, you say to other people, I don't care about you. If I am COVID-19 and if I infect you with COVID-19, that is your business. No, it is your business. Anyway, so when they were asked, can humans be considered as disaster? 36% said agree, strongly agree. But still 9% disagreed with it. And 23% were in the middle, neither agreed, neutral, no, nor disagree. Now, this in itself, I think, even is enough, you know, about the degree of responsibility. Now, in this article, actually, you know, what kind of communities they belong, you know, a human community or non-human communities. Now, this article, I hope it will be published as soon as possible, because it considers this issue. So let me send this away too. You know, this COVID-19 taught us many things about our society, our social structure. So let me continue with other studies about COVID-19. Two more persons I will be talking about. The third person after Belma and Elif, I will be talking about Socio-cultural Akşit. Now, Socio-cultural Akşit had her BA in health administration in Başkent University, and then she had her BS in science and technology policies program in Middle East Technical University, his MS, as I said, and then she had her philosophy degree in philosophy of health, or philosophy of science, philosophy of knowledge, philosophy of science and knowledge, but medical knowledge in this case, because her thesis is titled, let me very quickly share her thesis. It's very interesting, you know. It is about Hippocrates, you know, who is just across Kaş, you know, Anatolia, Kos Island, you know. So it's a part of Anatolian, ancient Anatolian culture. You know, we are talking about 500 BC, before Common Era, before Christ, or before Common Era. And if I share this very quickly, let me do that now from here. Now, where is it? Here somewhere. I think it might be this one now. Let me see. Let me see. Yes, it is the one here you see. Let me make it larger. So the title of thesis is Woman's Nature, Phusis. Nature is Phusis, and diseases as objects of observation in the Hippocratic gynecological writings and epistemological study. Okay, now this is submitted to philosophy department in Middle East Technical University, and actually, you know, Hippocrates is the oldest disease treatment person, doctor. You know, the founding of medicine, the founder of medicine, but she concentrated on treatment of cases of women in the Hippocratic text. You know, she learned Greek, ancient Greek language, and she read these texts, Hippocratic texts, and tried to study the cases there and women illnesses in those cases, and how actually woman's body emerged as an object of treatment. So actually her work was also like Elif Ekin's work on women and health, and of course Hippocrates as the founder, Hippocratic corpus, as it is being said, Phusis and theory of four humors. So there is a Turkish abstract as well, but the rest is you know, an English thesis. Those who are interested, they can go into it. Let me send away. Now let me focus. Actually, you know, she has some research on nursing theories and models of nursing, and also she has an article about being an ill. What does it mean? You know, actually she has been teaching here demography in Hacettepe University Sociology Department and social services department, social services department, demography and sociology of health and illness in the graduate school here. And she has an article about this disabled, children in families, the families of disabled children, and then she was the advisor to various MA and PhD theses about nursing, about health, these issues. And then lastly, together with Ezgi Eyüboğlu, Dilge Kodak, İlknur Yazıcıoğlu, and Aliye Haydar Dudaklı. Now let me very quickly share this again, very quickly. They presented this paper in a conference yesterday, actually. Now let me see which one it is. Here it should be. Now where was it? This one then. Okay, this one. Let me share this. Now, let me go up here. As you can see here, do you see it? Let me see. Yes. Gökçe Su, Ezgi Eyüboğlu, Dilge Kodak, İlknur Yazıcıoğlu, Ali Haydar Dudaklı. And it is about media exposure, the impact of, I translate it this way, the impact of media exposure on health-related risk perception during COVID-19 pandemic, an intergenerational comparison. Now, very quickly, let me go down. It is both a qualitative and a quantitative study. It is both qualitative and quantitative. Let me go down to the quantitative finding as a result of, their model is something like this, risk perception and media exposure. What is the dependent variable? Dependent variable is having COVID-19 vaccination, or the behavior of having vaccination intention for vaccination is the dependent variable. And when you have a regression analysis, here comes the regression analysis, one of the findings. Now, all these multiple regression analysis, all these factors, R is 0.7, which is a high R, and R square, the percentage that these factors that they put into their model, and especially risk perception and media exposure. Media exposure influences risk perception, and the two together influences awareness about, you know, what I was saying, 30% masks protect yourself, 70% others, or vaccination not only protects yourself, but also others, you know. So media exposure increases this awareness and contributes to vaccination behavior. It increases vaccination, and their qualitative findings contribute, you know, what is the meaning of, you know, how do they reach information, and so when they analyze the interview, in that interviews, 7 domains emerge. One of the domains is metaphor. How during the COVID they felt imprisoned, you know, kind of, or how they went, you know, over cleanliness, over hygienicness, etc. You know, those kind. Or the second theme emerged as the risk perception. Of course, you know, for example, going to consumption centers, or the whole the commercial centers, going to work or working from home. That's from COVID. Risks about having vaccination, COVID-19 vaccination, or not having it, and stigma. Now, in the next research, we will see that stigma, how important stigma is. Okay, now this is, you know, you can go into details when this research is also published. You know, it is presented, as I said, in a conference yesterday. You can find out in which conference. Okay, the last research that I would like to go into is a research that Belma Akşit was advisor, and I was also advisor. So two advisors, Ceren Alkan Üstün, and her thesis title was Infectious Disease-Related Risk, Responsibility and Stigma, Examples of Coronavirus and Human Papilloma Virus, a PhD thesis in sociology, Hacettepe University. Now, I will go quickly into the findings of this research. Now, in order to do that, let me very quickly go into my okay, now here it is. I am there. Okay, now maybe very quickly I can share this so that you will follow me while I quickly review this. Again, share my screen this way, and it is which one? Infectious disease related. Okay, infected disease related risk, responsibility, and stigma. Examples of. Okay, here it is. Let me see. Do you see it? Yes. Okay. Now, very quickly. Now I go down Now, she says that, okay, in the thesis, Ceren Alkan Üstün is saying that comparing these two viruses is interesting because they have two different sociological characters. You know, their relationship with the social structure, of these viruses. Of course, viruses not related with the society, but they are related with the society in various dimensions. They are related with the society when they cause a member of that society or a family of that society, and through them its health institutions, through them the whole health bureaucracy, through them even the whole transportation, education, all aspects of social structure. So she started her research with human papilloma virus, and then when COVID-19 came, she included that. We included, we thought she, of course, proposed as the researcher. We were all excited. The comparison will be interesting. So she applied the questionnaire through online. 800 people. We think those answered them. While parallel to this quantitative analysis, she did 25 in-depth online interviews. It was during the pandemic. So about coronavirus, how it started she gives information about its development, as you know, day by day, month by month, year by year, worldwide. We followed it, what's happening in Italy, in England, in United States. So how many people had how many cases? I think it's approaching 1 billion cases, and how many it's something like approaching perhaps 6-7 million, maybe it will approach 10 million. Anyway, so in Turkey, how many million cases? 15 million cases, and 100 million, and number of deaths almost reached 100,000. Now, what is human papilloma virus? Is after this COVID or after cold infections, it's also a viral infection, and one of the most prevalent viruses which are sexually transmitted. So it requires skin to skin touching. So there are many strains of, like, COVID-19. There were many varieties emerged. So there are also various strains of HPV, or human papilloma virus. So it usually causes cancers in the vulva, vagina, anus, and penis. Now, wrongly, it is being taught that only women catch this HPV virus, but no, both man and woman catch it. And in the world, there are now 600,000 cases and in Turkey there are 2,500 something, 2,000, around 2,000 via. Now, why this human papillomavirus is important? Because according to one study, 85% of people in the United States, this is a study in United States, 85% will, in one way or another, will have an HPV infection. So I will generally, one can say that in Turkey too, 85% of population will experience it, one way or another. But 10% of these people will have eventually a cancer. The rest, it will be treated, especially if they are vaccinated. Vaccination here, inoculation, is really important, and especially in the young age, like in 11 and 12 years of age. If girls and boys have this vaccination, then the likelihood of spreading of this virus will decrease. Now, Ceren says in the thesis that coronavirus and HPV virus, you are also reading it together with me, are two viruses which are quite different from each other in terms of transmission route and risk group. Hence, they are associated with different social meanings and carry different metaphors. That's why comparing them in the framework of risk, responsibility, and stigmatization. These are the three areas, three themes that Ceren Alkan Üstün is analyzing her data in the areas of responsibility, stigmatization, and risk. So both viruses are compared in these three areas: risk, stigmatization, and the third one is responsibility. Most important aspect. So risk, in sociology, risk society, we know that from our theories. But in this area, in health and illness area, she gives reference to Douglas and Lupton as two theorists in this area. Risk perception is one of the important variables. And in the interviews, as well as in the quantitative data, it was found that those who are the rate of those who think that they will develop serious health problems if they were infected with coronavirus in those aged 60 and over was higher than people at a younger age. For HPV, it was thus the opposite. Both the perceived risk of transmission and fear felt due to HPV in general was observed to be decreasing with age. So in the first one increasing, and the other one, but actually even coronavirus, when it is higher than 60 plus, again it decreases. I think I have to go now now she goes into responsibility, preventive measures and responsibility. Now, confidence in their use and the extent to which they are applied are other factors in the context of the results show that it is thought that coronavirus precautions are better known than HPV precautions. Yet it is more possible to prevent HPV by taking precautions. That is, it is more possible to avoid HPV. How? By mostly getting a vaccination, and secondly, controlling your sexual behavior, being aware of your partners, and taking precautions, So in the case of HPV, perception of polygamy as a risk factor invokes the discourse of lifestyle risks. Lifestyle risks are perceived as avoidable risks taken due to lifestyle choices. When risk perceptions and perceived preventability of coronavirus and HPV are compared, the political dimension, perceived controllability, and responsibility becomes clear. With coronavirus, while coronavirus is perceived as a risk that is difficult to avoid and control, HPV is opposite. In other words, pointing out health as an individual responsibility is more effective in HPV because it is transmitted sexually. Polygamy is considered to be a risk factor, and since it is seen as a deviation from acceptable behavior, it is perceived as both more controllable and more accusatory, accusing the person, giving the responsibility to the individual instead of the policies, the community, the bureaucracy. It is easier to accuse the individuals. Now, stigma, one of the most important factors in both coronavirus and HPV is stigmatization. As you know from, again, sociology, symbolic interaction, sociological approach, from Goffman, you remember how stigma is, illness, infection in itself, whether HPV infection or corona infection, does not have a meaning. I mean, it is an illness like any other, but community attributes and such a significance by stigmatizing it, by accusing the person having that illness, is as if it is his or her responsibility. So people afraid of being stigmatized and hence afraid of telling or going to the doctors, telling about their illnesses. So increasing awareness about this, don't stigmatize those. Another thing, especially again in HPV, is feminization. Woman is more stigmatized and accused and medicalized. Feminization and medicalization is the most important findings. Okay, I will finish this now. Let me send this away. Actually, as you know, I like showing and reading tables together with you, so that I want to increase your table literacy, table reading literacy. It's a statistical literacy. How you can derive findings, meaning from statistical variations. Okay, now let me share Ceren's thesis with you. Let me go again, sharing my screen, part of this, and it is, let me see which one it is. infectious diseases. Okay, this one. And it is here, you know, there are 35 tables in the thesis. This is table 15. But there you will see, I will show 2-3 more tables. But in those tables, for example, in one table, there are 10 tables, you know, summarized. Now, most of the tables are cross tabulations. You know, in sociology, when our variables are ordinal, you know, not interval or not ratio variable, nominal or all ordinal. You know, most of our data is either nominal, yes, no, or ordinal, like age. Age is ordinal. So, you know, you can have four age categories: from 18 to 29, from 30 to 39, from 40 to 49, you know, 10 years of age, from 50 to 59, and 60 plus. Okay, so 1, 2, 3, 4, 5 age categories. So now the table is cross tabulation of age, and a Likert type statement. In one period of my life, in one way or another, I will have now I was intending, no, not this one. I will start with COVID-19, and that is in page 21 here, page 14. Okay, now the same thing except the article. Now, in one period or another of my life, I will catch coronavirus. The possibility of catching coronavirus is high. Now, agree, mostly agree, neutral, disagree, mostly disagree. You know, there are 5, but we collapse them into 3. I agree, you know, strongly agree and agree. Katılıyorum. The last one here. You see that? Yes, the last one here. Let me make it a little bit bigger so that you can see it better. You can read the numbers better. Okay, I think now you see the numbers. Okay, now what do you see? Let's look at the I agree, you know, strongly agree and agree percentages in terms of the age. Yaşta yüzde, percentage in age. When what we see that in age 18-29, it is 65. Then it becomes 69, but it drops in 40-49, but not important. But it increases to 71% in 50-59, the highest. And then it drops to 56% in 60 plus age. In general, you know, without dividing into age categories in the population, in the sample, it is 67%. So what do we see? Now we see that in all age categories, the likelihood of catching COVID, the perception of the likelihood of catching COVID-19 virus is around 60s. You know, it reaches high 71. So majority of the people, 2/3, more than 2/3 of the people think that they will catch. You know, they see a likelihood. Now, but when we compare this, with HPV, we see that this in the sample the likelihood of catching HPV, human papilloma virus, likelihood of catching papilloma is now decreases to 20. Now let me see. In the total, it drops to 18.9%. From 67%, it drops to 18. So from being 2/3, it drops to almost now 1/6, around 1/5. If it was 20%, it would be 1/5. So people think that catching HPV likelihood is not very high. You know, where is it high? It is high in young, now in 40-49 age group, it goes up to 26%. And in 50-59 age group, it drops to 6%. It's interesting. In 60 plus, it is 16%. Whereas from between 80 and 49, it is in the 20s. It's about 20s actually. So you can see that perception of two viruses, coronavirus and HPV virus, is so different in terms of the perception of the likelihood. Let me now go down. Did I report wrongly? Let me see. No, I did. That 18.9 was the middle, undecided. Now, agree, that I will catch is 25%. So one fourth of people think that they will catch. Now, in terms of ages, it is. I'm sorry. You see, while reading the table, and the table is not in the same age. Even I, in my life, I have read maybe 1,000 tables, and even I am mixed up. So be careful while reading tables, but don't afraid. Don't develop a fear of table reading. But now the last row. Let me go back to the last row of the table, is katılıyorum, agree and mostly agree. And there we are looking at percentages in age, yaşta percentage, in age. And it varies from 31.7% to 14.9%. So as age increases, the perception of likelihood of catching HPV virus is decreasing. Age increasing, likelihood of catching HPV virus is decreasing from 31.7% to 14.9%. 14.9%. In the sample, it is 25%. I hope I corrected my reading. And sometimes, doing errors, you see, without committing errors, you cannot catch the truth. I am excusing my fault here, my error. Don't be fooled by that. It was a mistake I made there, and I am apologizing for that. Now, you see here, that table over there is being repeated for those statements that are used in her questionnaire, the ones that are statistically significant. What is statistically significant? This last column is all, in this case, it is Mann-Whitney-U test, probability of mistake, probability of having this distribution in, for example, the first one, coronavirus disturbed me. It is, if we do this, we administer this questionnaire 1,000 times, only in three of them, this percentages will come out not because of a determination, but independently of a determination. What is the word? The word accidentally, not as a result of a causation, but as a result of without any causation. Actually, there is the likely, this is alpha error, in this statistical readings, alpha and beta errors. Alpha error is, you find a finding, if it is incidentally that finding emerged, but you take it as if it is a determined finding, then it is alpha error. And now I will not go into that. It is complicated. You have to learn that in your statistics courses, which you learned actually. You had your statistics lessons, 2 semester statistics lessons in second year, and if you do your graduate study, you will take further. Anyway, now it says, now this is controlled. There it was being controlled by age. Now here it's controlled by gender. Gender. Now women and men are compared. Now catching coronavirus is disturbing me. Agree and mostly agree is 81.6% among women, while it is 72.8% among men. So men thinks that they are less likely than women, although it's likely. They think that 72% of them think that it's likely. The next statement: coronavirus is a serious threat to my health. Again, women think more, 76%, and men 66%. So 10% difference between the two. In all those, for example, human beings are exaggerating coronavirus. One of the statements in the questionnaire. Among women, 21% think that it is being exaggerated, whereas men think that more, 24% of men think that it is being exaggerated. In parallel with the first ones. Okay, now this is the last table. Similar statements, but this time HPV is disturbing me. As you can see, from 70% it dropped to 43%, 9 for women, and 10% less, 33%, 8 for men. From 80% actually, it dropped to 40%, to 33%. What is constant is between men and women. Women think that the possibility is more serious, is higher whereas women think it is more serious, man think it is less serious. So you see in our research in Antalya, squatter housing, Ahatlı squatter housing, Belma Akşit was successful organizing women because of these differences. Women take health and illness issues more seriously than men. Men, they think that, as they are men, they will not afraid of ill. No, viruses don't think about manliness or womanliness. If you are not taking your precautions, you catch it. You become ill, and men die as women. Maybe more men die than women. For example, second thing, the effects of human papillomavirus will be longer. It will take long, and again, women 49.7% think that it is long. It's a long period, until it is being controlled completely, and whereas 40% of men. Now, for example, this statement: being monogamous, tek eşli olmak. Being monogamous protects me against HPV. Yes, says woman, 72% 6, whereas men, even there, although it is not 10%, it is 7% difference now between the two. So let me send this away also. Okay, now as you can see, the issue of relationship between social structure and viruses and illnesses and health and institutions and families and individuals, this is a small sample of research I was able to cover during this lecture. But I hope that it alerted you to read more research on this issue. Now, if you learn more, if your awareness increases about these viruses, and if, as a result of this, if you take your precautions, like you go and vaccinated, and encourage others around you to be vaccinated, then you will be helping yourself, and you will be helping the society as a whole, others as well. It is a brotherly, sisterly, social, public behavior that is required of us as human beings. So read more research about this, and in your career as a sociologist, do more research or help others do more research in this area and in all other areas that we covered in 2 semesters in this course. So I will stop here, friends.